Hello, my name is Yekaterina Kusirova. I'm one of the radiology residents, and today I'm going to present you our case of vulvar epithelioid sarcoma, which is rare malignant soft tissue tumor. Rarity of the disease causes delay in diagnosis and lack of guidelines for optimal treatment. So we will present a case of this entity supplemented by radiologic images. So here we had a 20-year-old female with no history who presented with increasing groin mass for 4 months and associated pain. Initial evaluation was done with CT abdomen pelvis with intravenous contrast. On your left, you see axial reconstruction, and on the right, sagittal reconstruction. So CT showed large peripheral enhancing soft tissue mass in the left inguinal region, predominantly located in subcutaneous tissue. Also, prominent left inguinal lymph nodes was found with similar characteristic measured up to 1.3 centimeter, which is not shown on these images. Subsequently, this patient underwent MRI of the pelvis with intravenous contrast to further evaluate this mass, which was done approximately 1 month apart from CT. MRI showed increasing vulvar mass with large area of central necrosis. And so on the left, this is T2 weighted images, axial reconstruction MRI, and you can see this large necrotic mass. And on the right, this is post-contrast images that showed enhancement of this mass with areas of necrosis. The mass was also burdening external iliac vasculature and invading left rectus abdominal muscle and was also extending to the skin. In addition, increasing multiple adjacent satellite nodules lymph nodes were also noted. This patient underwent the following treatment plan. So she had a variant transposition first to preserve fertility with subsequent neoadjuvant radiotherapy followed by the surgery. Discussion. Epithelioid sarcoma is a malignant soft tissue tumor which usually occur in women of reproductive age and often occurs labia majora and frequently misdiagnosed as benign lesions such as Bartholin cyst, lipoma, or genital worm. Due to its benign appearance, diagnosis and treatment can often be delayed. It occurs in women, again, of reproductive age, pretty young age, and diagnosis is based on typical pathological features. Diagnostic imaging help to characterize the tumor by describing its location, margin, transition zones, as well as defining its relation to adjacent neurovascular structures, muscles, and bones. An ultrasound tumor might look as lobulated, ill-defined hypoechoic lesion with moderate extent of internal vascularity on color Doppler. On CT, tumor might show lobulated contours with some demonstrating peripheral calcifications. MRI features are non-specific with variable degree of necrosis, hemorrhage, and granulomatous area. Treatment. Due to rarity of this entity, there is no treatment of choice. Proposed initial management includes surgical excision with adjuvant radiation therapy. Adjuvant chemotherapy does not seem to improve the outcome. The prognosis of the epithelioid sarcoma, unfortunately, is unfavorable. The lack of symptoms belies its aggressive nature with rapid tendency of metastases and high recurrence rate. Thank you so much for your attention, and if you have any questions, you can contact me by my email, which is shown below on your left. Thank you so much.